This is Dr. David Stoker, board certified plastic surgeon in Marina del Rey, here to talk to you about laser resurfacing. What is laser resurfacing? Typically, laser resurfacing means using some type of high intensity laser energy to remove the outer wrinkles or sunspots on the face, neck, or chest. It's also applicable to the hands and arms in some cases. Laser resurfacing is most powerful on the face. The reason is the face is more resistant. It heals more quickly, so we can go deeper with the laser resurfacing and consequently get more dramatic improvements, more removal or a reduction in the amount of wrinkles, more removal of sunspots. Once you go below the jawline, it's necessary to turn the power settings down because the skin of the neck and the chest, the hands, it's more fragile. It doesn't heal as well, it doesn't respond as well to the treatment. Typically, in those areas below the jawline, you're going to benefit from multiple lower level treatments rather than the higher level treatments above the jawline. There are different types of lasers for facial resurfacing. There are carbon dioxide lasers and erbium lasers. Carbon dioxide is by far the most effective at reducing wrinkles and sunspots on the face. There's also ablative lasers versus fractional lasers. Fractional is the newest, the latest and greatest type. What that means is instead of removing all of the outer skin, the laser shoots a bunch of tiny little pixels into the skin so that, for instance, 37% may be treated on the face, but it's a very fine pattern so that it leaves treated areas immediately adjacent to untreated areas. The benefit being that the skin heals much more quickly. There are fewer problems that you can occur, less downtime, and that's a big deal for these patients. The downside is it's not quite as effective as ablative surgery, but I think most patients are quite happy with this latest and greatest technology. It's important, if you can, to pre-treat your skin with a retin-A and or hydroquinone. Those are topical treatments which will help to ready your skin by getting it revved up and ready to heal more quickly if you do the laser. It's important to avoid sun, so you don't want to do this just before your Hawaii vacation or as you're approaching summer, but over the holidays it's a great time to consider this type of treatment. It's not an all or nothing phenomena. In my laser, which is one of the latest and greatest, we're able to turn the settings up or down and modulate it depending on patient needs, which include what the amount of wrinkles they're trying to correct, the amount of downtime that they have, and we can dial in those settings to optimize that for them. If you are considering these procedures, I would encourage you to check out the pictures on my website. It's truly extraordinary what we can achieve with this type of resurfacing procedure. It can be done more than one time, but most of these cases are a one and done type of procedure. It can be done under topical anesthesia or in the OR with an anesthesiologist present. It can be combined with a facelift or eyelid surgery or done separately. It's highly variable, but a very powerful tool as long as you have expertise in one of the latest state-of-the-art fractional carbon dioxide lasers. I do really enjoy this procedure because of the dramatic improvements I can make for patients. If you're interested in a consultation, I'd be happy to talk about your best options in detail. Please call us up for a consultation if you're interested. This is Dr. David Stoker, board certified plastic surgeon in Marina del Rey.